Hi, and welcome to AAHPO's American Armenian Health Professional Organization's TV Health Program. This program is sponsored by Holy Name Medical Center. And tonight we have a very interesting and common heart problem, which is called congestive heart failure and causes many hospitalizations for many patients. We have our guest here tonight, board-certified cardiologist, Dr. Kasarian. Dr. Kasarian, welcome to our program.
Thank you for having me.
Tonight we're going to discuss about one of the most common problems that we encounter in our offices, which is congestive heart failure. How do you define congestive heart failure? What is congestive heart failure?
Congestive heart failure is a problem when the heart doesn't work as it should, and the patient starts experiencing shortness of breath when they do simple things around the house, like walking to the bathroom or walking up the stairs, or when they go to the market, they feel breathless.
Right, so the main symptoms are really the shortness of breath coming in. Could be ankle swelling.
Sure.
Associated other symptoms that could be ankle swelling. Any other chest pain could be with that congestive heart failure?
Sure, if it's due to blockages in the arteries, they definitely can get chest pain when they walk. If the heart gets dilated, they can get edema in the legs. Their legs can get swollen. They can get swollen in their stomachs as well.
Right. So we have different causes of congestive heart failure. So it could be a coronary artery disease, blockage in their hearts. It could be that their heart is enlarged. What else could be?
It could be from people drinking too much alcohol.
Right.
It could be from
So we call alcoholic cardiomyopathy.
Correct.
Yeah.
It could be also from congenital diseases that we don't understand how it happens, but they're born with genetic predisposition to it.
It could be a valve problem.
Sure,
Sometimes.
you can have a valve if the valve is too leaky or if the valve is too tight. Also, sometimes you have a cardiomyopathy caused by infections, by viruses.
So the main symptoms that they should look and they should be careful and be aware and present to their physicians or call their physicians is that really shortness of breath.
Correct.
It does not have to be with the heart, chest pain.
No, it doesn't have to be chest pain. Actually, sometimes if a patient is diabetic, they won't have chest pain.
And you mentioned a very good point, actually, the diabetic patients, because they have nerve numbness or so, we should say, in their chest, they might not experience chest pain at all. They might just, their sole presentation might be shortness of breath.
Correct. Right. I do see that a lot.
So if somebody has congestive heart failure, what that person will be doing, what the physician of that person will be actually doing?
Well, the first part is to figure out why they have congestive heart failure, and then after we figure out why, we try and see if there's something reversible. Obviously, the hope is always that it's something reversible,
Right.
and most times we can. And then what we try and do is put them on the optimal medications. There's certain medications that heart failure patients should be on, and they work really well. 20 years ago, we didn't have the medications, and a lot of the older doctors say that it was a miracle when these drugs came out, and patients did a lot better.
What percentage of the patients do you think that they end up in the hospital instead of being treated outpatient at home?
Probably a third of patients will end up diagnosing when they present to the hospital. The other third show up in the office, and unfortunately the other third, they die suddenly because they didn't know they had it and it went too late.
So the warning sign for all the patients that they have possible heart condition, even they were not diagnosed before, is really shortness of breath and difficulty of breathing probably.
Correct. Anything that when they're walking with their friend or their cousin or their family and they have to stop to catch their breath, and it's something not extraordinary, just like walking to the kitchen or walking down the street, walking their dog, and they used to be able to do that. That's important.
Sometimes the patient come to my office and they say, "Doctor, when I lie down at night and I'm in trouble, I'm okay when I'm sitting up, but when I lie down at night, suddenly I cannot breathe." What does it tell us?
That's also a problem. That's a sign of that at night everything is backing up. It's called orthopnea. That's the medical term, but that's also a sign of congestive heart failure, because when we lay down, the fluid gets transmitted backwards and the breathlessness becomes worse. So that's another warning sign.
Right. So at night, when they cannot sleep on their back, they are having shortness of breath, or in regular activity, daily activity, they have shortness of breath, not necessarily associated with chest pain.
Correct.
They have to be.
A typical presentation that I see a lot is actually the patient comes in and tells me, Doc, I've been sleeping on my couch, sitting up for the past 3 months.
So their medication, let's say, in terms of prevention of the congestive heart, because before congestive heart failure happens, certain things are there already with the patient.
Of course.
It could be high blood pressure, it could be cholesterol, they could be diabetic.
Correct.
Right. Okay, so let's talk about those risk factors for congestive heart failure.
Sure. You already mentioned the most important risk factors. Those are diabetes, hypertension, and high cholesterol. Obviously, we'd like to prevent all these with just eating right and exercising, but if it's already to the point where they have them and they're on medication, it's really to target the hemoglobin A1C, the doctor that they go and they check every 3 months to make sure that's good control. The blood pressure being less than 140/80, nice and good control, and the cholesterol being low. And these are all to prevent the reversible causes.
Right. So let's talk about the cholesterol. So most of the patients, they come and say, what's my total cholesterol? What's my cholesterol level? But actually, we don't, in medicine, we don't concentrate on total cholesterol.
Correct.
We concentrate on more good
Yeah.
and bad cholesterol and
Correct.
triglycerides level. Let's talk about the bad cholesterol level first.
So the bad cholesterol is called the LDL,
Right.
and you're absolutely right. Most people, they come to say, my total cholesterol is 200, and I tell them, well, I'm really not interested in
Right.
that. What's your bad cholesterol?
Right.
Because you can have a total cholesterol of 200, and that actually could be good if your good cholesterol is high.
Right.
So an LDL, depending on your risk factors, for example, if you have diabetes, which we treat as, we just assume we treat you like you have heart disease.
Right.
So that person, the LDL should be targeted very low, below 100.
Right.
If you're a person who doesn't smoke, doesn't have hypertension, doesn't have diabetes, 160 or less is okay.
Right.
Obviously, we keep an eye on it if you have other genetic risk factors or family history.
Right. But if somebody has congestive heart failure already, they have been treated or they've been in the hospital for a reason, we want their LDL cholesterol less than 100 for sure.
As low, the lower the better.
The
There's
better.
actually data to show that for every 10 points below 100, there's less cardiovascular events.
So 70, we should actually for 70 and below for diabetics. Anyway, for the coronary artery, the same way. So how about HDL and the triglycerides? That becomes an important issue too,
Sure.
because besides LDL, we have those two.
Sure. The HDL is important because it's actually a negative risk factor. The higher we get the HDL, or your good cholesterol, the better it is for you. In men, it's typically a problem. We like to see it above 35. But again, the higher the better. Exercise, eating the right kind of fatty fishes, not the white meat fishes, but the red fishes like salmon and
Right.
tuna, flaxseed, olive oil, these kind of things can help elevate it, but exercise also.
Exercise is the main thing really
Main
for the
thing,
HDL.
absolutely.
And then for women, it's different because women usually in my practice I say 50 and above for women, and 40 and above for men for HDL.
Correct.
How about the triglycerides? Because that goes really hand to hand with the HDL good cholesterol.
Sure. Triglycerides are more of a marker of a precursor to diabetes. That's what I try and tell. There's really, unfortunately, no hard data to link triglycerides to actual heart events of heart disease. But triglycerides are a precursor to someone becoming diabetic. So it's a warning sign. The sugar in their body is already too high, and their body's trying to store it up in triglyceride form. And the lower the better, obviously.
And then obviously it goes hand to hand with HDL. The higher the triglycerides, lower the good cholesterol
Correct.
HDL, so that actually then becomes a risk factor for heart again.
disease, right.
Right. Let's say a patient comes to your office and patient is short of breath and has coronary artery disease, and you did an echocardiogram in the office or electrocardiogram. You think that patient really needs to be in the hospital. You put patient to the hospital. Now let's take from that, give a little scenario to the patient of what happens in the hospital. What is expected to be seen in the hospital?
Sure. If a patient is in heart failure and we admit them to the hospital, the first line of agents that we use is something called diuretics.
Mm-hmm.
They're medicines that make the patient urinate more.
Right.
And this is to get rid of the fluid. 'Cause
Right. So it
usually-
might be given intravenous,
Correct.
not necessarily pill form, but intravenous.
Right. They'll get started with an IV.
Right.
They'll get put in a bed.
Mhm.
There'll be someone taking their blood pressure every few hours.
Right.
There'll be someone weighing them every day. But most people, when they come in, the main line is giving them diuretics, which is something to make them urinate.
And they'll be on the monitor for sure because
Correct.
we are monitoring their heart too.
Right, they'll have-
And oxygen will be probably on, so they should be expecting that they have oxygen on. They
Correct.
should give them some medication. Intravenous will be started. Right. And then let's say they are improving with that condition, and then they are going to go home. The main thing is that now we are facing is that the medication reconciliation for them, and they get confused what medication they were taking home and what medication now they were in the hospital. What's your advice to the patient to do when they are discharged home?
So discharge is one of the most important things once the diagnosis of congestive heart failure has been established. The problem is a lot of times either medications are not taken properly or the diet is not followed, and they end up back in the hospital in a month or in 2 weeks. So two actually the most common reasons why patients get readmitted to the hospital is because they're not taking their pills or they're eating too much salt. So the most important advice I can say is, number one, take the medicines as you're prescribed, and number two, the nutritional guidelines that are given to you when you leave is very important to follow.
And then probably they should weigh themselves every day to see if there's any weight differences. Probably they might retain more water. They should be
Absolutely.
alerted, and then they call their physicians.
Absolutely.
Dr. Kasarian, thank you very much for coming to our program. It was very enlightening. We'll see you hopefully in another program.
Thank you.
Now it's time for this week's article, and it's about nuts and seeds and longevity. Nuts and seeds are nutrients-dense foods that are rich in essential fatty acids, vitamins, minerals, and fiber. They also contain polyphenols, which have antioxidant effect on lipids, including LDL bad cholesterol, and they affect the platelet coagulation. They have been shown to prevent and be effective against arteriosclerosis, hypertension, and cardiovascular disease. Nuts and seeds also have anti-cancer, anti-inflammatory, antivirus, and anti-allergic properties. Recently, a study from Harvard Medical School examined the association between nut consumption and total cause of mortality among men and women. The outcome of this study was that the consumption of nuts was beneficial, and people that consume nuts had less chance of having heart disease, lung disease, and cancer. So if you're not having nuts and seeds in your diet, try to add some handful of mixed nuts, walnuts, almonds, hazelnuts, pistachios, and seeds such as pumpkin and sunflower seeds to your diet every day. Good health is precious and priceless. Stay informed by visiting AAHPO's website, www.aahpo.org. I'm Dr. Ohan Karatoprak. Until next program, so long.